It's time now for 5 tips to healthier living. Since we've been talking about emergency medicine, this would be a great time to give you some tips to a successful trip to the emergency department. Of course, we hope it's not necessary, but just in case. First, make sure you establish and regularly see a primary care physician. The best medicine is prevention. A PCP can help screen for disease, diagnose common conditions, and help manage and stabilize chronic illnesses. Prevention and maintenance can avoid the ED altogether in most cases. Next, compile critical data. Even though we live in a time of electronic medical records and technology, getting to that data and ensuring it's accurate can be very challenging, especially if someone is critically ill. I recommend having a folder that is handy which has pages outlining your medical problems or diagnoses, allergies, medications with dosages, and pharmacy, as well as any advanced directives or next of kin information. This can be invaluable information when you present to the emergency department, and honestly, it can save your life. Third, be patient. U.S. emergency rooms are seeing over 140 million people every year. This has resulted in longer wait times across the country. EDs will see patients in the order of need and acuity, not necessarily on the time of arrival or wait. I assure you that the staff is working as efficiently as possible and don't want to have to see anyone waiting for extended amounts of time. Just remember, we don't control how many people seek our care, and we never know when there will be a rush of critical patients. Next, seek that proper level of care. This can help avoid some of those wait times if you have a minor condition. Urgent treatment and walk-in clinics are nice for minor illnesses that can't wait until regular business hours with your PCP. I advise my patients that if you know the problem and the solution, it's probably okay for urgent treatment or waiting to see your doctor if it's stable and not in need of emergent attention. I also advise my patients that if the issue involves the head, chest, or abdomen, it's probably best to go ahead and go to the emergency department where we have the tools to help diagnose complex problems. I regularly see folks that go to a walk-in clinic first and are referred to the emergency department for further evaluation and management. Finally, if you have a true emergency, call 911. I often see patients with heart attack or stroke drive themselves to the emergency department. This puts you and others on the roadway at risk. If it's an emergency, 911, so they can start care earlier and safely transport you to the emergency department.